Welcome to Cardiac Alterations Part 1. Today we're going to go over some of the cardiac diseases. First one is coronary artery disease, which is a progressive narrowing of coronary arteries and atherosclerosis, or is biatherosclerosis. So then we have coronary heart disease and atherosclerotic heart disease. In order to test some of these illnesses or diseases, we have some diagnostic studies that we have to do to find out exactly what kind of disease it is specifically. So we do EKG always, and sometimes the doctor will give a patient a Holter monitor to wear for about 2 weeks. A stress test is done where the patient exercises to see if they tolerate exercise. You have to run on a treadmill and they time you and take your blood pressure while you run. And if you're not able to get to the heart rate that's required to show that you passed physically, so running or walking, they will give you or they will induce a stress test with a chemical called adenosine. Other diagnostic studies would be chest x-rays that can show if the heart is enlarged or if there's water around the heart. And another one would be echocardiogram, which can see how the heart pumps, if there's anything wrong with the valves, if there's any regurgitation. Also, it can check to see the ejection fraction of the heart, which a normal heart, healthy heart, should be 65% or above. What are other illnesses? What are other diagnoses the heart can have? A heart murmur. Now, babies have heart murmur sometimes early on, but that resolves itself later on in life. And it is caused by turbulence of blood flow through the valves. It sounds like a musical sound, blowing, whooshing, rumbling, uh, like a harsh sound when you listen to the heart. Now, if blockage is suspected in a heart, cardiac catheterization and arteriography it's done. A catheterization is basically a patient taken to the cath lab and a cardiologist will enter through, let's say, a femoral artery to check to see where the blockage is and take it out. Arteriography, artery means artery and graphy means image, so visualizing blood vessels, we're going to look at the blood vessels and see on the screen. Probably usually they inject a dye to see it better, and we can see how the arteries and veins look like, if there's any blockage or if there's any narrowing. After catheterization, it's important to take care of the patient. Number one concern is bleeding. So patient has to be on bed rest. Raise head of the bed no higher than 30 degrees. Don't let the patient get up for about a half an hour. Antiplatelet drugs are given after the procedure. And like I said, monitor for bleeding. Monitor pulses. Make sure that the pulses are good in the legs or whatever limb they went through or extremity. Make sure the pulses are still good in that extremity. And the patient can be discharged within 6 or 8 hours if there are no complications. We also do laboratory tests to check how the heart is. We do a CBC, check hemoglobin, hematocrit. We check potassium, magnesium, calcium, sodium, and BNP. All these will show us how the heart is doing. BNP, the normal is 100. Anything above, there are patients that have it even in thousands. That means something is really wrong with the heart. We also check for cardiac enzymes. We check for CK-MB, which is cardiac specific, myoglobin, but the number one test that is ordered by providers is troponin. Troponin, INT. Troponin will show up as early as 1 hour after the injury. If somebody comes into the ER with a chest pain, they do EKG quickly and troponins. They want to check if there's any injury because it's the most sensitive and it will show up faster than any of the other ones to show if there's any damage in the heart. Now, myoglobin and CK just shows that there's muscle damage, but it doesn't show necessarily that it's cardiac muscle. We just don't know which muscle got damaged. How do we treat patients with heart disease? We have to encourage a diet low in cholesterol, fat, and low salt. Have to encourage exercise and medications such as lipid-lowering agents. Like cholesterol, triglycerides, they need to be normal if they're high. Medications for hyperlipidemia will be like statins, like atorvastatin, fibric acid derivatives that get rid of VLDL or LDL, which is the low density cholesterol. We have high density, low density. The low density is the one that's bad for us. High density is the one that's good for us. We also give bile acid raisins that bind and they bind that fat and excrete it via intestines or your bowels. And we give nicotinic acid that lower lipids in the body. One of them would be niacin. Niacin is the most potent, natural, I guess we could say mineral or vitamin. You know how we take vitamins. Niacin is something you can just buy over the counter. It's a natural supplement. That's the most potent natural one that can lower cholesterol, but it takes a long time for it to work. Patients who have heart disease and they're prone to blood clots will be placed on aspirin and clopidogrel and other blood thinning medications. Let's talk about angina. What is angina? Angina is basically just temporary pain you feel in your chest, and it usually comes on with some kind of exertion. Myocardial ischemia is one of the reasons you feel angina. Basically, you feel pain in the chest because not enough blood goes to the heart muscles. There's a temporary blockage of blood to the heart muscles, and so you start feeling chest pain. They usually go away. How do we manage angina? Well, since we don't have enough blood flow to the heart, we have to maintain cardiac output, relieve that pain, and also make lifestyle changes. If angina is brought on by stress, or maybe you have blockages in the heart but not complete blockages, you have to take care of those, remove them, or take medications to dissolve if it's a blood clot that's like a blockage, or if it's plaque or atherosclerosis, take medicines that help dissolve those plaques on the walls of the arteries. Sometimes some patients have to have stents placed in if it's more dangerous. Let's talk about heart attack or acute myocardial infarction. This is ischemia with myocardial cell death. So in this case, we do experience death of heart cells. Causes would be atherosclerosis, a blunt trauma, let's say a sudden car accident, you hit your chest, or some sudden impact makes your heart stop. Spasms can cause it. Blockages such as plaque or emboli such as fat or blood clot. Acute myocardial infarction will show on the EKG. You can tell if somebody is having a heart attack by looking at the ST elevation. If a ST is elevated, then they have a heart attack. If it's not elevated but inverted, then they have an ischemia. And we call acute myocardial infarction a STEMI, or non-STEMI heart attack. STEMI, that means there's a complete occlusion, and non-STEMI, there's a partial occlusion. So here's a picture of an EKG. How do we assess a heart attack? So of course we will ask the patient if they have pain. They will tell you for sure. They might be pale and sweaty, have dyspnea, tachypnea, nausea and vomiting, dysrhythmia, and syncope. And if you look at this right here, this is normal. The ST segment is normal. But if you were to be right here, going up and then down, that's an ST elevation. That's a heart attack. This is the most dangerous one. And if it were, I'm going to the last one, come down a little bit more, and this would be basically ischemia. It's an ST depression. And also if there's an inversion of the ST segment, this is ischemia, so it's not a total blockage, just partial. How do we diagnose heart attack? Well, again, we'll look at signs and symptoms: pain, diaphoresis, patient is pale, heart rate is up, they have difficulty breathing. We'll look at the EKG, which shows ST elevation or depression. We do lab work, which shows us if the cardiac enzymes are elevated, such as CPK-MB. We also look at BNP, troponin, and myoglobin. This will be elevated if there's a heart attack. What are some complications of heart attacks? Well, congestive heart failure, which leads to cardiogenic shock, ventricular aneurysm or rupture, papillary muscle dysfunction, pericarditis, arrhythmia, and even death.